Now recognize the gentleman from Texas, Mr. Flores, for 5 minutes.
Thank you, Chairman Yarmouth and Republican Leader Womack, for holding today's important hearing to discuss what the government takeover of America's healthcare system would look like for hardworking American families. The conclusions that we can draw from the CBO report confirm what we already know, and that's that this type of upheaval abandons free market principles, severely restricts the incentive for young Americans to join the healthcare field, and then leaves the American people with no choice, longer wait times for treatment, a rationing of care, and significantly higher taxes. This flawed thought process would build the single largest bureaucracy in the history of this country to control a sixth of our economy. Mr. Hadley, I thank you and your colleagues for being here. My first question is this: do you have a feel for what the aggregate spending would be for a single-payer system? I know you don't have a bill to look at, but what do you have? What would that be like?
We don't have an estimate yet, in part because it would depend on so many of the design choices that people make in terms of who's covered and what kind of services they receive.
In the report, you say the CBO states that the transition toward a single-payer system could be complicated, challenging, and potentially disruptive. Can you spend about 20 seconds on each of those terms: complicated, challenging, and potentially disruptive?
So it would be complicated. We talk about some of the complications in the design choices, but in the transition, particularly if you were moving so many people from one insurance plan to another, there would be an initial upheaval as you tried to reassign all of those people and get them enrolled in the new plan. In terms of disruption, depending on the payment rates and the services that are covered, there would be shifts in the economy for who would be employed, and there would be shifts in the demand for different goods and services, and so it would affect the overall economy as well.
If you look at the, we just heard some comments about the VA. It was called the good, the bad, the ugly, and one of the single largest set of issues that we have to deal with in constituent services back in the district are VA claims. And so the VA takes care of roughly 9 million Americans. It has a bureaucracy of about 378,000 federal employees to do that. So the ratio of beneficiaries to federal employees is about 1 to 24. If we were to use that same ratio to cover 372 million Americans, would that imply, that implies a federal bureaucracy of about 16 million people compared to the Department of Defense, which is the currently largest federal agency with 2 million people. What is the accurate number of bureaucrats we'd be looking to hire to take care of Americans' health care?
Again, I don't have an answer for that, in part because we don't know how the system would change from the if you look back in history, in 2017, the total healthcare spending was $3.5 trillion, all in.
I guess suffice to say it could be massive. It could be easily the single largest federal bureaucracy in the government.
You could end up with many more people working for the federal government, but also having federal contractors play a significant role might also be an option for policymakers. Do you have a feel for what the improper payments are from Medicare percentage-wise? For every dollar of Medicare payments, what the improper payments are? I don't have that number in front of me.
Okay. But we do have a significant percentage of improper payments coming out of Medicare today. Is there any reason to assume if you had a government-run healthcare system that you would have a lower percentage of improper payments on that $3.5 trillion of healthcare spending?
Well, it depends, again, on the choices in the system. One of those choices, how much they're going to invest in making sure that there are not improper payments. Some improper payments are simply because of the failure of paperwork, and other ones are the result of fraud. And depending on how much investment there is in fraud prevention, it could be higher or lower than we have today.
But you still have government running this, and so you'd have to assume that suddenly the government gets a whole lot better. It's something that has struggles with today, and you've created something massively larger, not you, I'm talking about the federal government, creating something massively larger than the VA today or than the Medicare system that we have today. The CBO report states that in a federally administered single-payer system, the associated cash flows would be federal transactions, in CBO's view, and the spending and revenues for the system would appear in the federal budget. Can you explain this further?
Sure. One of the issues that we face when we are thinking about the government interacting with a sector of the economy is the extent of government control, and at what point should those be considered part of the federal budget. Under a single-payer system, it is clear that those would be governmental, and to the extent that it is administered at the federal level, then there'd be no question that all of those are federal payments. So all of the spending that would occur from such a system would show as federal spending, and then depending on the financing that's used to help pay for that, those
I
would
want
also
to
show.
be respectful of my colleagues' times. I'll submit all the rest of my questions supplementally, and you can answer them supplementally. But if we had a government shutdown, theoretically, all the health care payments could stop. So I yield back.
Gentleman's time has expired.